Hello everyone, welcome to my channel The Healthy Glow. This video is about post-COVID care or the care that you need after a long suffering from COVID-19. In my previous video, I talked about our COVID journey, the complications that took place, and in this video, I'll focus mainly on the post-COVID care and how to avoid the post-COVID complications. So I have divided this video into two parts basically. The first part contains the post-COVID signs and symptoms that your body is showing, and the later part, the care that you need or the kind of attention that you need to give to handle them. What most people commonly term as tiredness, exhaustion, weakness. Is it only the tiredness, exhaustion and weakness that we are going through post-COVID? Obviously, as far people say, there is weakness, there is exhaustion, there is tiredness. Those things are common terms. I think I'll give more precise examples to what happens post-COVID. Number one is palpitation that many of us or most of us face. You start to feel that suddenly your cardiac system is overexcited and anxiety, panic or palpitation. Number two, your shaking of hands or certain kind of trembling in your body parts that happens to such an extent that things can fall off your hands. Number three, heavy breathing or short of breath. Whenever we are trying to do some kind of work after your COVID is over, obviously, now that work is not something very heavy. It's very simple household daily course of ours that we need to do. So for example, bathing. Now during bathing you are having water all over yourself, but at that condition also you can feel that your body is running short of breath all of a sudden. Even after your bathing, when you are trying to dry yourself off with that towel, you are falling short of breath in doing that very simple work that you used to do very frequently with very ease. So that is the amount of toll that your body has taken, and now you have to overcome it. Number four, chest pain, which happened to me, and post pneumonitis, because in the COVID I suffered from pneumonitis. After the pneumonitis was over, doctor said that it is a very common symptom, but you should get it checked up with the doctor because this can give rise to various other complications. So better you have your treatment, get the tests done right at that period of time when your doctor says, and do not delay in anything. That is my earnest request to everyone. Most of the people who are dying post-COVID is because of the negligence. They think that COVID is over, okay, my body can take anything that I used to do before and my body is ready for everything. No, your body is not ready for everything, and your body needs time for its full recovery. I'm not saying that you lie down all the day. That is not something post-COVID care means. Actually, you have to be active, but active in a correct way. You have to do a 6-minute walk test. You have to take all the vitamin C fruits, edible, I'm talking about edible fruits that you used to take, the care that you used to take both in terms of diet and in terms of different activities. Those have to continue. A very common post-COVID problem that most of us are facing is lung fibrosis or pulmonary fibrosis. Another problem is pulmonary embolism. All these problems can have far-reaching effects, especially in our nervous system, in our cardiac system, and in our excretory system also. Another common symptom is loss of smell and taste, which happened to me. Still, it's not entirely back like before. So that will also stay till 1.5 to 2 months. So what do we actually need to do? We need care. We need consultation with the doctors at the right moment of time. We should not neglect all these symptoms. Third is that we should be very strict about our diet at this point of time. Number four is that we need to maintain cleanliness all around us, because apart from wearing mask and sanitizing your hands, the environment in your home should be neat and clean. This is very, very important part. So all the news that you are getting all over the nation and the world about post-COVID complications and the numerous millions of deaths that is occurring due to post-COVID complications that can be actually handled if we become careful at the right point of time. So let me start with this. What are the things that you should continue in this post-COVID stage? Number 1, steam inhalation and gargling. Many people have many views regarding steam inhalation and gargling, and for me also doctor suggested that not more than twice a day you should do steam inhalation. So that only you continue post-COVID, because for me I just saw the pain right at the middle, the chest pain that I just told happened to me. After taking steam, it was completely gone. So this is something which I faced and I'm sharing this as per my experience. Number 2 is that continue taking vitamin C enriched food. Now that your medicines and the treatment that you were taking is over, you are out of medicines, the diet is actually acting as your medicine. So improve your diet. You should not leave the citrus fruits or the vitamin C enriched fruits that you were taking earlier, like mosambi, like orange, like lemons, and all the citrus fruits. Make vegetables and fruits as a major part of your diet, like as if they are an integral part of you till the next 1 year. Number 3, kadha. Many of the people asked me after I made the previous video that what is actually the kadha, or what are the ingredients that I am using and how I am consuming it, how often or how frequently am I having the kadha. So I am going to tell you about how I make the kadha, what are the ingredients in that. So the main 5 ingredients that you need to make kadha are: number 1, tulsi; number 2, black pepper; number 3, ginger; number 4, cloves; and number 5, cinnamon. Now all these 5 ingredients you need to boil, and better you take boiling water only and you have all of this mixed in that boiling water. Boil for 5 minutes, and obviously you should close the lid because the vapor or the steam should not go out. That contains the major ingredients. After those are boiled, you just add a few drops of lemon and add 2 to 3, as you like, 2 to 3 tablespoons of honey. So that will give you the right amount of flavor and you will feel good or better to have the kadha. Both me and my husband took the kadha twice a day. Post-COVID, you can take it at least once a day. Number 4 is Chyawanprash. This is something every Indian is familiar with. So Chyawanprash, I do not need to do any introduction about it. It contains the major ingredient as amla, which is very important at this point of time because you need to boost up your immunity. Now when and how to take? Have 1 tablespoon of the Chyawanprash with something hot like tea or coffee, or even hot water will do. And also if you want, you can add 1 tablespoon of honey with it. Number 5, ORS, that is oral rehydration solution. I think every one of you know with this that doctors also say that you need to have plenty of fluids, plenty of fluids. So ORS was actually suggested by a family doctor, one of our family doctors, who said that post-COVID, when your treatment is over, the medication is over, all the medicines that you had already has an effect on your body. So the vital minerals and salts in your body, they are not in a balanced condition now. And that's why sometimes the brain signals that is carried by many salts in our body, those become unbalanced, and due to that effect, sometimes this falling of things out of our hands, or rather not being able to concentrate, that happens. So this is a very, very important thing, especially those people who are having joint pain, because whenever we reported that this joint pain and muscle pain post-COVID, it was a very, very bad condition. So the doctor immediately said you need to have ORS. Drink plenty, lots and lots of water and ORS. Number 6, health drink. Now you need to add a very important thing in your diet, that is a health drink. Make sure it's a very good one, and it actually covers all the vitamins, minerals, nutrients that you are not actually having in your diet. Means you are taking your diet, but all the enriched things that you should get out of the diet, that will be compensated by your proper health drink. This I came to know from my dad, who actually was admitted to the hospital for COVID in the previous year, and he was in a very critical stage at certain point. In the hospital, he was given a very good health drink. Ensure he was given. So even if you cannot buy Ensure, have any other health drink. It's not that you need to buy something like that only. You can have various other health drinks are there. Make sure that you take it at the right point of time. The next and the most important one is dry fruits. After the steroids or after all the medicines, now you need to boost your immunity. And for boosting your immunity, the major thing that will help, especially if you incorporate that in your diet, those are dry fruits. So what are the dry fruits? Dry fruits like apricots, figs, all the dried berries which has huge amount of antioxidants in it. So berries like blueberries, blackberries, they are just remarkable for your health right now. Have more and more of almonds, walnuts, dates. These are the dry fruits which actually will boost your immunity in this condition. I can already feel the difference after having for about half a month. The last one is just a tip. It's not a diet condition. Avoid sweets or avoid sugar and extreme amount of salt. If your lungs are affected severely, have pineapple, have apple, have lots of cinnamon. If not possible, you can mix it with kara. You can keep some cloves in your tongue. If you are suffering from very severe coughing, you can do one trick, one very small and easy trick, which is actually very helpful when you are in this condition in isolation. 1 tablespoon of turmeric mixed with 1 tablespoon of honey. So you just have honey in it and mix turmeric and just have it then and there. It will, trust me, it will reduce your coughing to such an extent that your throat will actually be relieved. Many cough syrups also can't do such an amazing thing. Avoid cold conditions, especially if your lungs are affected. And if your liver is affected, then have lots and lots of apricot, have lots and lots of papaya and blueberries, cranberries, beetroot juices. Even tea and coffee is very good if your liver is affected. So these are some of the options which actually helps to reduce the overactive liver enzymes. Apart from that, a major component that you need for your liver at this point of time is that vitamin D. So if you are given a vitamin D capsule, that is okay. If not, even if not, just make sure that you walk in your rooftop or anywhere. Obviously you are post-COVID, so now you can walk also outside. During the time of 8 o'clock to 10 o'clock in the morning. So that period of time actually has a very active component of vitamin D that your body can absorb out of the sun. Now coming to the most important part of this video, that is suggested both by the doctors and the people who have recovered out of it, that is breathing exercises. Some patients are known to recover only by doing breathing exercises post-COVID. So you realize how important this is, the breathing exercises, because whenever you are feeling short of breath or you are feeling breathlessness in a condition, palpitation is starting, remember that this breathing exercise before and after condition, you can yourself feel the change. Take a deep breath. Hold it and just turn on your stopwatch. See how many seconds of breath you are holding. I am just giving a small demo or example. This is not physically I am going to do here, but still a small example. Taking deep breath. Hold. If you can hold your breath above 20, then your lungs are actually becoming stronger and overcoming the weakness that it had before. Number 2, blow the candle. That is, I call it as blow the candle. It's actually heavy exhalation. Take a deep breath. Hold. Now as if you are blowing the candle, just exhale like that. So it is deep and long exhalation and inhalation normal. Blow the candle is actually suggested by every doctors that I talked with. The next exercise is deep inhale and deep exhalation. That is simple. You can do it in the meditation form also. You can repeat it 10 times in 3 sets. And then comes pranayama. So pranayama, I think you can see in any YouTube video. The 3 main breathing exercises out of the pranayama that is possible in this condition. Number 1, Anulom Vilom. Number 2, Kapalbhati. And number 3, Bhramri. Trust me, you will get instant relief and you can feel the change in your breathing. So breathing exercise is a must if you want to heal. Now the main thing that I did not talk about for so long is your mental health. Post-COVID depression is very common and observed in maximum or most of the COVID-19 patients, that they have this feeling of regret or the depression that happens to occur because they realize that why me out of everyone. This why me thing is something that needs consultation, and if it is really severe, if the person falls into depression like that. So this is a request out of everyone that kindly handle the COVID-19 patients well with a good behavior, with empathy, with compassion, because post-COVID the depression persists very well. A common suggestion will be that ignore everything negative around you. All the negativity, all the negative people, negative comments that is coming to you. Ignore everything actually. Only if filter yourself in such a way that if anything positive is coming, take that. If anything negative is coming, you are not listening or you do not know what it is. Behave like that there is a filter around you to filter the negativity or the negative things, anything. So act like that and you will feel better, trust me. Do something which you have always loved to do. Follow your hobbies. Music therapy is a very good treatment in this condition. Then greeneries, if you surround yourself with greeneries, you can also do gardening if you like it. It will actually help you to cope up with all the negative things. Last but not the least, cleanliness. I told this at the starting of the video also. Now also I'll just tell something that you should follow or maintain. Change your clothes daily. If it was possible during COVID or not, now post-COVID, make sure that you are changing your linens regularly. Make sure the masks that you are wearing, those are washed properly at regular intervals. Make sure that your bed cover and bed sheets are changed frequently at regular intervals. And the curtains of your room are neat and clean or not. Another tip will be that to use mosquito nets if it is difficult to wear masks at your home all the time, because you are already staying in isolation. So if you have mosquito nets all around in the bed, then you can easily sit or do any activity inside that only. It will make yourself isolated also. At the same time, ventilation will also be good. So before ending this video, I'll just tell everyone to stay active, not completely lying down on your bed. Healthy food, fresh air, adequate amount of sleep and stress management. And of course, breathing exercises. If you observe anything abnormal in your body or you can feel anything abnormal, immediately report to your doctor. And whatever the test he or she is prescribing, kindly do that. Most of the people are neglecting the tests, they are not doing the tests, and they do not know how the complications are arising, and all of a sudden we are losing dear and near ones. So all the best to all the COVID survivors. Post-COVID also we have to fight, and make sure you maintain a positive attitude in that. Please do like, share and subscribe to my channel if you like my video. Thank you.